Good evening. I'm Ali Velshi in for Brian Williams. Day 198 of the Biden administration as the nation searches for a way out of the Delta variant-fueled COVID surge. The Wall Street Journal is out with new reporting about booster shots. The Journal reports the FDA expects to have a strategy for vaccine boosters by early next month, one that would detail when and which vaccinated individuals should get the follow-up shots. Tonight, vaccine maker Moderna also preparing for boosters. The company says people who received 2 doses of its vaccine will likely need a 3rd dose before winter.
One of the most important things we need to do is actually bring the Delta variant into the vaccine. And that way we're teaching the immune system what the Delta variant looks like in our vaccine, just as we did with the prior variants in the virus.
All right, this is all taking place as the U.S. reported more than 100,000 new COVID cases yesterday, numbers that have not been seen since February. Hospital admissions are up 41% over last week. COVID deaths up 39% over the same period.
These cases are concentrated in communities with low vaccination rates. In fact, over the past 7 days, Florida and Texas have accounted for about 1/3 of new cases.
Health officials in Texas are among those sounding the alarm about the virus's resurgence. They say this outbreak is very different than what we've seen before.
What you can see is the rise in cases is similar to what we've seen in previous waves and might even be steeper. And that really shows how contagious the Delta variant is. It's spreading much more rapidly among unvaccinated people than the viruses that we saw last year.
In the Houston area, where the COVID-19 threat level has been raised to code red, officials paint a stark portrait of the situation.
We find ourselves retracing our steps toward the edge of a cliff. It is very conceivable that we could once again be heading toward a public health catastrophe. This is no longer a disease of the old. The average age of the patient being admitted into Texas Medical Center hospitals is 20 years younger than it was before. We're now having patients on average in their 40s, which means there's people in their 30s.
NBC News reports there's another troubling sign in this latest surge. The number of nursing home patients and staff infected with COVID-19 is now also on the rise. But there's some encouraging news in all of this. Administration officials say more people are now choosing to get vaccinated. Over the past 24 hours, officials say another 864,000 people got the shot. That's the highest one-day number since July 3rd. Dr. Gupta, let's start with you and the discussion of booster shots coming up. On one hand, we've got a massive spread of coronavirus, numbers that we have not seen for several months, and we're talking now about getting boosters for those who have been vaccinated.
Good evening, Ali. The pharmaceutical companies need to stop leading on messaging on this topic. First, Pfizer did it. Now Moderna is following. It's a habit that they can't quit. They need to stop doing this because the message I hear from unvaccinated young people is, Doc, do I now need 3 doses of a vaccine to be protected? It's confusing people, and they need to stop it. What's clear, and what I suspect FDA is going to release in the coming weeks, I'm glad they're doing it, Ali, is that if you're immunocompromised, if you have cancer chemotherapy, it's a long list here. 4% of America has that condition. You will get a 3rd shot you'll be eligible for a booster shot before the end of the year. If you're over 65, likely you will be in that group as well. For the rest of us, there is no indication you need a booster shot. So let me repeat that. For the rest of us that are otherwise healthy, less than 65 years of age, if you receive 2 shots of the vaccine, you're likely not going to get a booster shot in this calendar year. Frankly, you may not even need one in 2022. That's what the data is telling us today. So they need to stop leading with this messaging and defer to public health experts.